My name is Paul Ramos. Currently, I'm one of the Director of Account Management for Workers' Compensation and Disability. I've been here in Shearwater Health since 2015. However, I took sabbatical leave on 2020, then returned. I'm a returning of Shearwater Health on 2021. I started my nursing career as a clinical bedside nurse in Philippine Children's Medical Center. So I'm a pediatric hematology oncology nurse for 3 years there. And then I was supposed to fly in to Australia. However, it didn't push through. So it took me some realization over there, and that's the time that I decided to join a BPO healthcare. I'm still looking for a bedside role, still for a pediatric role, not in the cancer area. However, there's some problem with the agency at that point in time. It closed, so my application left hanging. So technically, I'm abandoned by my agency, and I don't have the interest to really push through because of that devastation that I felt. It's not really on my plans. I don't have plans of going to the US or even plans of going abroad. My colleagues in college, most of them are already into the US, and when we have these reunions or even connecting into the group chat, they're always asking me, what's your plan, or when I'm going to join them. My answer is, it's still not in my heart to really go to the US. Only thing that make me realize my dream of going abroad came to happen last year when I got married. So things have changed. My passion of going to the US reignited, and that's the time that I decided to apply for the Nurse Compass program. I started as a program manager in workers' compensation for one of the biggest third-party administrators clients that we have. So when we started, that's the first time that we have this team here in Cebu. We have already set up the team in Manila, and they need a leader that can start and set up the team here in Cebu. It's quite challenging considering that I'm already handling for a program manager about 60 or 70. I'm from the bedside. Shearwater Health is my second BPO healthcare. So the character that you are going to build throughout the years, that's really gonna speak for you. People are not going to remember you for the position that you hold, but the relationship that you're able to give to them at the end of the day. So my learnings is be always humble and always aim that you wanted to learn every day, because every day is a new learning. Considering this is a totally new role from what I'm doing previously, which is operation. But this time around, the role that I'm going to be working there is an account management. So it's more of a free-flowing actually. It's more of relationship building. Company's vision and mission are important, especially the mission part. If your personal mission is going to be aligned with the company's mission, then you're going to stay longer. And the mission of Shearwater Health is to help the healthcare industry globally. And I wanted to have this leave a footprint at the end of the day into the healthcare industry, even though that I'm not working on the front end side. It's a good thing into this journey to have those kind of leaders and mentors to share experiences with you. Josen is one of them. She mentioned that she also undergone the same hurdle, which is the RFI. And when I heard and I understand regarding her testimony, that makes me more at ease that what I am experiencing right now is just a normal part of the process. There are two things that really made me in joining the NCP. The first one would be the location. In my prior nursing agency, I was supposed to be deployed in New Jersey. This time around, in Nurse Compass, I'm going to be deployed in Tennessee. And one of the value proposition that Ryan Kelly specifically mentioned to me is the cost of living, because I don't have the first-hand experience of the cost, especially that my main intention of going to the US is really to build a family. So he mentioned to me that to start a family, it's better to start with a state that is not very costly. The other one would be the setup of the work. In the Price Nurse Recruitment Agency, I'm supposed to be deployed in a home health care setup. And Shearwater health offer for me is to continue my job in the CPO healthcare space, which will make me transition easier than going back to the bedside again. I remember this book, The Hardest Thing in Life is to be put in a waiting room. And I agree to that one. I think all of us, especially Filipinos, hate to wait in a line. But I think the benefit of waiting is it builds your character. It builds your patience. I'm able to have those self-realization, what's important to me, and go back to my roots and go back to my main purpose of why I need to go to the US.